mic and view to Dr. Philip because he is going to share a little bit more in depth about diabetes, connection with his heart surgeon, so with the cardiovascular diseases, and what can we do to avoid complications, and if complications happen, what can we do to help ourselves, and what are his take on all this. So Dr. Philip, take it on.
Thank you, Irina. So, as I was mentioning during the roundtable discussion, we know that diabetes is, a major risk factor for heart disease. And, heart disease is the disease that I deal with every day as a heart surgeon. And it ends up being, one of the most common factors I see in patients that come to me as a heart surgeon. But I also have a, second part of my professional life, which is now helping people to stay off my operating table and teaching them how to avoid heart disease. And again, reversing and optimizing the management of diabetes ends up being one of the most important factors in that. I just want to, I didn't really prepare any slides here, but I do want to share one quick slide here where, this is a study that was came out last year. It was looking at the Women's Health Initiative study. They followed this group of women for 20 years and looked at the risk factors for heart disease, for those that developed heart disease. And you can see right up at the top, #1 risk factor was type 2 diabetes. And having type 2 diabetes increased your risk of developing heart disease by 10 times. The metabolic syndrome, which is the precursor to diabetes, essentially, increased your risk 6 times. And when you look down at the bottom there, the bottom is some of the blood markers that they looked at. And this measure of insulin resistance that they used, lipoprotein insulin resistance, increased your risk of developing heart disease by 6 times. And, when we talk about heart disease, almost everyone focuses on LDL cholesterol. And you can see from that slide that LDL cholesterol does increase your risk of heart disease, but it's a minuscule increase in risk compared to diabetes, insulin resistance, and the metabolic syndrome. So, when I work with people on preventing heart disease, my focus is on avoiding the metabolic syndrome, and if they have diabetes, reversal or at least better management of that diabetes. And I wanted to go a little bit more into, what good management of diabetes looks like. And, I always sort of, I guess, am somewhat saddened that I, as a heart surgeon, have to be helping people how to manage their diabetes. And, that the endocrinologists, the diabetologists, the family doctors are not doing as good a job of this as I think they can be. As I mentioned, type 2 diabetes is a reversible disease, full stop. If you have type 2 diabetes, your goal should be to reverse that disease. Now, we are seeing these situations where people with type 2 diabetes for long periods of time essentially start to develop type 1 diabetes. And I guess to step back, just to reinforce to this crowd, the difference between type 1 diabetes and type 2 diabetes, they're really two separate diseases because type 1 diabetes is a lack of insulin, and type 2 diabetes comes from an excess of insulin to the point that your body is no longer responding to that insulin. And the only reason that we think of these as the same disease is because what we look at as healthcare practitioners, the end effect of that is that your blood sugar goes up. But we get there by two different mechanisms. and they can cross over, so people with long-standing type 2 diabetes who have been making very high levels of insulin for long periods of time, and then their body doesn't respond to that insulin adequately anymore. And then you can actually get to a point where your pancreas essentially burns out or gives up and stops making enough insulin. So now you have a low insulin state and your cells aren't responding to insulin. And, so sometimes that ends up being not completely reversible, but it is improvable. And if you're a type 1 diabetic, again, as I mentioned earlier, your goal should be to have normal blood sugars, normal hemoglobin A1C with as low a dose of insulin as is necessary. And I have, again, I know of type 1 diabetics who get their insulin dosage down to very, very low levels, like single digits units of insulin a day, and they maintain, perfect blood sugars. So it is possible, and you do need to push your physicians. And the reason it's so important, like I said, is we know for type 1 diabetics that, all of the major complications that occur from diabetes, heart disease, blindness, kidney damage, vascular disease leading to amputations and infections, these are all directly correlated with your dose of insulin over time. The more insulin you use over time, the more at risk you are of these complications, even if you're keeping your blood sugar under good control. Now, of course, not keeping your blood sugar under good control is an even bigger problem and an even bigger risk factor. But if you need more insulin to control your blood glucose, you are going to be at higher risk than someone who controls it with lower doses of insulin over time. And for the type 2 diabetics, again, the higher your hemoglobin A1C is, the poorer your glucose control is. And again, the more medications you're using, whether that be insulin or the other medications that we use for type 2 diabetes, the more medications you use, the higher the risk of the complications. So as much as possible, you and your physician should be working together to reverse or reduce at least, the amount of medication that you're needing to manage your disease. Ultimately, we all have to be asking ourselves very important questions, and this is where the self-care, kind of comes into it. You need to be asking yourself, and you need to be clear with yourself and with your practitioners about what your goals are and what you are trying to accomplish. And, the reality is that most people in their day-to-day lives don't necessarily sense, what their blood sugar is. Yes, if it's very high or it's very low, you're going to be getting symptoms of that. But, unless you're actively measuring it, you don't really know what your glucose is. But what you do know is you feel good, you have energy, you're able to make it through your day without being tired. Your joints don't hurt, your body doesn't hurt. You're able to play with your kids or your grandkids. You're able to, do all the things you want to do in life. So those are the goals to be focused on. And it just so happens that those then correlate with, blood markers like hemoglobin A1C and how much medication you're taking. And, when you do things to reverse your diabetes, all of these other things, happen. You lose weight, you feel better, you have more energy, your joints stop hurting. So those are the things that I really tell people to be, aiming for. One of the concepts I talk about in my book and, when I work with patients is that you want to think of your health as a system, not as a goal. And, what that means is you want to be looking at the overall picture of your health and your goals, the overall, objectives that you're trying to reach. And you want to be finding the habits that support that. Things like eating whole, real food, that I mentioned before. You don't necessarily want to be focused on these short-term goals, like, I want to lose 10 pounds. Because when you focus on the short-term goals, one of two things happens. Either you meet the goal and you lose the 10 pounds and you say, great, I did what I wanted to do. And now I can go back to, whatever I was doing before, and invariably end up gaining back the weight and more. I'm sure most of us have had that experience. Or maybe more commonly, you don't meet the goal, you don't lose the 10 pounds, you get discouraged, and you're like, what am I bothering for? I'm just going to go back to my old habits because I wasn't able to do what I wanted to do. So instead, by focusing on the overall health system, and telling yourself that I'm going to find the habits that support my overall health. I'm going to find practitioners to work with that are going to support my overall health. And then that becomes a more positive and a more sustainable way of thinking. So ultimately, each one of you is in control of your health, and you have already taken a great first step. You've joined the Facebook group. You're spending your Saturday morning or your Saturday evening, depending on where you are in the world, in this summit, and you're seeking out the guidance of the practitioners and the people that are here in the group, and that is a great first step. And then you just got to keep at it, and you have to be true to yourself. You can't compromise your goals. And the way that I see this most often happening is people go and they see their physician, and their physician's like, oh, well, you can't do that. You can't reverse your diabetes, or why did, you don't need your A1C to be normal, under 7 is fine. And so, and then they don't, push back on that. And they don't say, well, I want my A1C to be 5.6. I want it to be normal. And, don't be afraid to push your practitioners. The other place this shows up is in your family and friends. We all know that oftentimes you'll be like, okay, well, I've decided I'm only going to eat whole real food. And then you'll be out with your family and friends, and they're like, well, why don't you eat this? Eat this. And, again, you have to have the conviction, you have to have the fortitude to say, that is not supporting my health. That is not something I want to eat. And the reality is, if you're a good friend, if you're a family member that truly loves me, you're going to support me. I am doing this to improve my health. I am doing this to improve my life. And so, the friends and family around you should support you. Like I said, take back control of your health. That's really my main message. And I hope, this little talk, this little information was helpful to people. And I'm certainly happy to answer any questions that anyone has.
Excellent. Thank you very much, Dr. Philip. And now, yes, the mic is open for everyone, or the chat room. If you have questions, if you need to clarify something and you feel that Dr. Philip is the person you was waiting to ask this question, please do so. We specifically reserved this time for this conversation, and we have like 7 minutes to ask those questions. Please use this opportunity. We will.
Can I ask a question, Dr. Philip?
Yes, please.
Yep.
I have a lot of patients who self-supplement, and I've always been curious as far as people wanting to self-supplement for vitamin D. Does that negatively affect the calcifications in their vessels? Does it accelerate? Is there an upper limit? How do you manage that level of self-care?
Yeah, so, vitamin D is probably one of the most common deficiencies, in our society today. It does seem to be nearly universal. So, supplementing with vitamin D probably makes sense for most people. But, there are cautions around that. The first caution I give everyone is you should be measuring your vitamin D level. It's easy enough to do, standard blood work. They even have home finger prick tests today for vitamin D that you can do. So, you want to be measuring your levels to make sure that you're supplementing adequately, or you're not overdoing the supplementation. Probably, a good range to aim for with vitamin D is somewhere between, 40 and 80 or 90 or so. When it starts getting above 100, I think that may become problematic. And then it's important to be paying attention to the type of vitamin D that you are supplementing with. So vitamin D3 is the active form of vitamin D, and that is the form you should be using. A lot of the less, the lower quality vitamin D supplements are going to be vitamin D2, and our bodies really don't do a good job with converting D2 to D3. They can a little bit, but take vitamin D3. And then it is very important to always be taking vitamin K2 with your vitamin D3. And again, K2, there are two primary forms of vitamin K. There's K1, which is primarily derived from plant products, and there's K2, which is primarily derived from animal products. And vitamin K2 in particular, which is also in a lot of fermented foods besides animal products, but vitamin K2 kind of regulates the deposition of calcium, is how I explain it to people. So it prevents the calcium from ending up in places we don't want it to, most commonly our blood vessel walls. So vitamin D3 with K2, it's essential to always take them together, and then just measure your levels, take enough to get to a good level, but you don't have to take excessive amounts of it. And of course, the preference would always be that you get your vitamin D level up without the supplements. And that involves exposing yourself to the sun, having good metabolic health. Vitamin D turns out to be a marker of metabolic health. And there are many markers we can look at to determine if people are metabolically healthy, but almost universally, what I see is people with the metabolic syndrome, people with poor metabolic health have low vitamin D levels. And when they improve their metabolic health, their vitamin D level will come up without supplementation. And then, like I said, good diet, getting out in the sun. If you can get your vitamin D levels up without supplements, that's always preferable. But if you are going to supplement, measure your levels and take vitamin D3 with K2.
Dr. Philip, I have here a question in the chat from one of our listeners, and it says, my doctor told me that when my A1C was 4.1, that was good, but it tells her my glucose is irrational. Is that true?
So an A1C of 4.1 is excellent. I'm not sure what they mean by erratic or irrational blood glucose. The only sort of caveat around A1C that I give people is it is, an average blood glucose over time. So it doesn't tell you whether you're having, you can have highs and lows. With an A1C of 4.1, which is very low, I would say you're probably not having much highs. And I really wouldn't have that concern. But ultimately, if you want to go beyond A1C and you want to know what your blood glucose is, what the patterns are, the best way to do that is with a continuous glucose monitor. And I think continuous glucose monitors are very underutilized. Here in the United States, really insurance won't cover it for most type 2 diabetics unless you're injecting insulin multiple times a day. Yes, they're a little bit expensive, but I think it's a good investment in your health. And, for most people, I don't think you need to be wearing a continuous glucose monitor year round, constantly. But I do, like, for instance, with my patients, I'll typically, once every couple of months, they'll wear a continuous glucose monitor for the 10 to 14 days and kind of get a better sense of what their patterns are. Because people, and again, 4.1, I wouldn't really be worried about, but people who are 5.6, 5.7, they're kind of on that border, you can have a 5.6 and be eating a carnivore diet and have basically a constant glucose level of 110 or so. And you can also have a 5.6, and you can be having spikes up to 200 and then hypo episodes down to 50 or 60, eating a processed food diet that you're chasing with, medication. So that's where, oftentimes going beyond the continuous glucose beyond the hemoglobin A1C, and really using a continuous glucose monitor to make sure you're not having wild, erratic swings in your blood glucose can be useful.
Excellent. Thank you. We have one more question that came from Facebook. It looks like our live translation, or how do you call it? Our live in Facebook is working. We
Great.
see people are listening to us. And the question is, Dr. Phil, can you give general guidance on at what level of blood sugar should someone go to ER? We keep seeing posters on Facebook page asking strangers if they should go. There's a post right now of someone with the 479.
So 479 is a very high level, and that's probably someone that I would suggest seek out immediate medical care, whether that's the emergency room or just getting in touch with your physician. I certainly start getting worried when I see people with levels, kind of above 300 or so in terms of the acute management. What we were, the real concern with high blood sugar is that it can cause you to go into what we call diabetic ketoacidosis. And this, ketoacidosis is a pretty complicated condition. Oftentimes it gets confused with dietary ketosis, from doing a ketogenic diet, and they're really not the same. But dietary ketoacidosis is where the level of ketones builds up in your blood to such a high level that it actually changes the acidity of your blood, and it can cause you ultimately to go into kidney failure, a coma. People can, get unresponsive from it. And the blood sugar is above, certainly in the 400s and 500s are typically, are where we see diabetic ketoacidosis. So, anytime you have a blood sugar above 300, I would say that's a time to at least call your doctor. And if you're having any symptoms, you're getting lightheaded, you're getting dizzy, you feel weak, you feel nauseous, those are things that might, those are reasons that you may want to even go to the emergency room if you can't get a hold of your doctor.
All right. Well, thank you. Thank you, Dr. Philip. And I wanted to bring everybody's attention again. We have agenda. I just reposted again the information about every speaker we have, and actually schedule for today. So if